Okay, this demo is about powder for reconstitution. So I have my IV bag, the powder that has to be reconstituted, the syringe, a regular needle, and IPA swab pad. So to begin, I'm going to do the cleaning. So start off with flipping off the vial top and cleaning the compounding port, get rid of the waste. And the next part will be to take the volume that is required to reconstitute this powder from the IV bag and introduce that into the vial, dissolve the powder, and then take out all that has been dissolved in the vial and inject it into the bag. So I'm going to peel the wrapping off. I'm going to remove the red needle and attach the pink needle to this very carefully. I'm not touching the syringe tip or the needle hub. So I'm going to draw liquid out from the bag. In this case, the bag material is soft and there's air inside this bag, and so you do not have to normalize the pressure. All you have to do is make sure that you pierce the compounding port straight and then pull back the plunger to withdraw the amount of liquid that is necessary. And you don't really need to measure the volume, but many times accurate amounts is fine. They recommend 5 ml diluent to be introduced into the vial, or 10 ml diluent to be introduced into the vial. In this case, I pulled out 5 ml, and in this case, again, I'm going to pierce the target area at an angle, and I'm going to push the needle down afterwards, and I'm going to introduce some of that liquid, and you'll see that because there's negative pressure inside the vial, it's actually pulling the needle, the plunger into the vial. And so this is a powder that goes into solution very, very quickly, within seconds actually. When you work with powders like this, one thing you need to remember is to make sure that all the powder has completely dissolved. Some powders take a long time. An example is daptomycin. It takes a long time for it to dissolve. Sometimes you have to keep it for up to even half an hour, and occasional shaking like this is necessary. And shaking the vial in this manner will circulate the diluent inside the vial and also facilitate dissolution of the drug. Okay, so I'm checking inside, it's completely dissolved, and as I mentioned, there are several powders that takes a long time, so you need to make sure that the powder has completely dissolved, because again, if it does not dissolve completely, you run the risk of actually not taking the required amount of drug that is necessary as per the prescription, or rather the medication order. So now the drug is completely dissolved, and when you're drawing liquid out into the syringe, one thing to remember is to pay attention to the needle tip inside the vial. So if the needle tip goes above the surface of the liquid, then you'll be pulling air into the syringe, which is not something that you want. So you need to make sure that you pull back the needle very slowly to make sure that it is still submerged in the liquid. And so you can very slowly kind of pull the liquid into the syringe. Make sure that all the liquid is pulled into the syringe, and take the syringe out of the vial. And then this vial is completely used, and so you can throw that in the shop's disposal container, and you inject the dissolved injection by piercing the compounding port again straight, and push the dissolved injection into the bag. And once you're done, you can throw the syringe needle assembly away also.